Assalamu alaikum, I'm Dr. Azman. Welcome to this lecture on Cauda equina and Conus medullaris syndrome, essential topics for final year MD students. Understanding these syndromes is crucial in clinical practice as they can lead to severe neurological deficits if not diagnosed and managed promptly. According to Apley's System of Orthopedics and Fractures, 9th edition, early recognition and intervention are key to preventing permanent damage. In this video, we will define Cauda equina and Conus medullaris syndromes, understand their clinical features, and explore diagnostic and management approaches. We will reference Apley's System of Orthopedics and Fractures, 9th edition, to provide a comprehensive overview. Specifically, we will cover the anatomy, pathophysiology, clinical presentation, diagnostic criteria, and treatment options for these syndromes. Cauda equina syndrome involves compression of the lumbosacral nerve roots, while Conus medullaris syndrome refers to lesions at the conus medullaris. Both are neurosurgical emergencies. According to Apley's System of Orthopedics and Fractures, 9th edition, the pathophysiology of these syndromes involves significant nerve compression, leading to motor and sensory deficits. This compression can result from various etiologies, including herniated discs, tumors, and trauma. Understanding the underlying mechanisms is crucial for timely diagnosis and intervention. The conus medullaris marks the end of the spinal cord at L1, L2, while the cauda equina is a bundle of nerve roots extending below it. According to Apley's System of Orthopedics and Fractures, the conus medullaris is a tapered lower end of the spinal cord. The cauda equina consists of lumbar and sacral nerve roots that provide motor and sensory functions to the lower limbs and pelvic organs. These structures are vital for motor and sensory functions. Causes of Cauda equina syndrome include herniated discs, trauma, spinal stenosis, and inflammatory conditions. Conus medullaris syndrome may arise from tumors, vascular lesions, infections, and congenital anomalies. Risk factors, as noted in Apley's System of Orthopedics and Fractures 9th edition, include degenerative spinal diseases, spinal surgeries, and certain genetic predispositions. Cauda equina syndrome typically has a gradual onset with asymmetric weakness, whereas Conus medullaris syndrome presents suddenly with symmetric motor weakness and early bladder dysfunction. According to Apley's System of Orthopedics and Fractures, 9th edition, a case study of a 45-year-old male with Cauda equina syndrome showed progressive lower back pain, unilateral leg weakness, and saddle anesthesia. In contrast, a 60-year-old female with Conus medullaris syndrome exhibited acute onset of bilateral leg weakness, severe lower back pain, and early urinary retention. These cases highlight the distinct symptomatology and urgency in diagnosis and treatment. This table highlights the key differences between Cauda equina and Conus medullaris syndromes. According to Apley's System of Orthopedics and Fractures, 9th edition, Cauda equina syndrome typically presents with lower motor neuron signs, while Conus medullaris syndrome shows a mix of upper and lower motor neuron signs. Clinically, Cauda equina syndrome often results in asymmetric symptoms, whereas Conus medullaris syndrome presents with more symmetric symptoms. Understanding these differences is crucial for accurate diagnosis and treatment. MRI is the gold standard for diagnosis. A detailed history and neurological exam, along with imaging, are crucial. According to Apley's System of Orthopedics and Fractures, diagnostic criteria include sensory deficits, motor weakness, and bladder dysfunction. Imaging techniques such as MRI and CT myelography are essential for accurate assessment. Management involves urgent surgical decompression, such as laminectomy or discectomy, and adjunct therapies. Rehabilitation is key for recovery, including physiotherapy, occupational therapy, and pain management protocols, as outlined in Apley's System of Orthopedics and Fractures, 9th edition. Complications include chronic pain, persistent neurological deficits, bladder and bowel dysfunction, and sexual dysfunction. Long-term outcomes may involve muscle atrophy, gait disturbances, and sensory loss. Management strategies from Apley's System of Orthopedics and Fractures, 9th edition, emphasize early diagnosis, surgical decompression, and comprehensive rehabilitation programs to optimize recovery and quality of life. Delayed diagnosis is a common cause of litigation. Proper documentation and timely management are essential. Case studies from Apley's System of Orthopedics and Fractures, 9th edition, highlight the importance of early detection. Legal precedents emphasize the need for thorough patient records and adherence to clinical guidelines. Let's discuss two cases to apply the concepts we've learned. Narrator. Our first case involves a 45-year-old male presenting with severe lower back pain, numbness in the legs, and difficulty urinating. After a thorough examination and MRI, he was diagnosed with Cauda equina syndrome. According to Apley's System of Orthopedics and Fractures, immediate surgical decompression is crucial to prevent permanent damage. The patient underwent an emergency laminectomy and showed significant improvement in motor function and bladder control post-surgery. Narrator. The second case is a 60-year-old female with a history of spinal stenosis, presenting with sudden onset of bilateral leg weakness and saddle anesthesia. MRI confirmed Conus Medullaris syndrome. Apley recommends a combination of corticosteroids to reduce inflammation and surgical intervention to relieve pressure on the spinal cord. The patient received prompt treatment and was closely monitored during recovery, resulting in a favorable outcome. Narrator. These cases highlight the importance of early diagnosis and intervention in managing Cauda equina and Conus Medullaris syndromes. Clinical decision-making, guided by established protocols like those in Apley's, is essential for optimal patient outcomes. In conclusion, early recognition and intervention are vital for managing Cauda equina and Conus Medullaris syndromes. According to Apley's System of Orthopedics and Fractures, 9th edition, understanding the anatomy, clinical presentation, and timely surgical intervention can significantly improve patient outcomes. Key takeaways include the importance of a thorough neurological examination, the role of MRI in diagnosis, and the urgency of decompressive surgery to prevent permanent damage. Thank you for watching. Feel free to ask any questions.
One common question is about the differences between Cauda equina syndrome and Conus medullaris syndrome. Cauda equina syndrome typically presents with lower motor neuron signs, such as flaccid paralysis and areflexia, while Conus medullaris syndrome often shows a mix of upper and lower motor neuron signs.
Another frequent query involves the urgency of surgical intervention. According to Apley's system of orthopedics and fractures, immediate decompression is crucial for Cauda equina syndrome to prevent permanent neurological damage.
A clinical scenario often discussed is a patient presenting with saddle anesthesia and bladder dysfunction. This is a red flag for Cauda equina syndrome and requires urgent MRI and neurosurgical consultation.
Students also ask about the role of imaging. MRI is the gold standard for diagnosing both conditions, as it provides detailed images of the spinal cord and nerve roots.
Lastly, the prognosis for these syndromes varies. Early diagnosis and treatment generally lead to better outcomes, but delayed intervention can result in significant morbidity.
The understanding of Cauda equina syndrome and Conus medullaris syndrome has evolved significantly over the years. Initially, these syndromes were often misunderstood and misdiagnosed, leading to poor patient outcomes. In the early 20th century, advancements in neuroanatomy and imaging technology began to shed light on these conditions. Pioneering work by neurologists and orthopedic surgeons helped to delineate the distinct clinical features of each syndrome. A major milestone came with the publication of Apley's system of orthopedics and fractures. The 9th edition in particular provided a comprehensive overview of the pathophysiology, clinical presentation, and management strategies for these syndromes. This text emphasized the importance of early diagnosis and intervention, setting a new standard of care. The evolution of surgical techniques and the advent of MRI technology further revolutionized the management of these conditions. Today, we have a much clearer understanding of the anatomical and functional differences between Cauda equina syndrome and Conus medullaris syndrome, thanks to decades of research and clinical practice. As we continue to build on this knowledge, the goal remains the same: to improve patient outcomes through timely and accurate diagnosis, followed by appropriate intervention. In recent years, the field of neuroanatomy and spinal surgery has seen remarkable advancements, particularly in the treatment of Cauda equina syndrome and Conus medullaris syndrome. Building upon the foundational knowledge set forth in Apley's System of Orthopedics and Fractures 9th edition, researchers and clinicians have made significant strides in refining diagnostic and therapeutic approaches. One of the most notable advancements is the development of minimally invasive surgical techniques. These procedures aim to reduce patient recovery time and minimize complications, offering a less invasive alternative to traditional open surgeries. Innovations in endoscopic spine surgery have enabled surgeons to access and decompress the affected areas with greater precision, leading to improved outcomes. In parallel, advancements in imaging technology, such as high-resolution MRI and diffusion tensor imaging, have enhanced our ability to differentiate between Cauda equina syndrome and Conus medullaris syndrome. These imaging modalities provide detailed visualizations of the spinal cord and nerve roots, aiding in more accurate diagnosis and tailored treatment plans. Pharmacological research has also made headway, with new medications being developed to alleviate neuropathic pain and inflammation associated with these conditions. These drugs, often used in conjunction with physical therapy, aim to enhance patient quality of life and expedite recovery. Furthermore, the role of regenerative medicine is being explored, with promising results in the use of stem cell therapy and tissue engineering to repair and regenerate damaged nerve tissues. While still in the experimental stages, these therapies hold the potential to revolutionize the treatment landscape. The integration of artificial intelligence and machine learning in clinical practice is another exciting development. AI algorithms are being designed to analyze patient data and predict outcomes, assisting clinicians in making informed decisions regarding diagnosis and treatment. As we continue to build on the knowledge encapsulated in Aptly's system of orthopedics and fractures, the future of treating Cauda equina syndrome and Conus medullaris syndrome looks promising. The ongoing research and technological advancements are paving the way for more effective, less invasive, and personalized treatment options, ultimately aiming to improve patient outcomes and quality of life. When diagnosed with Cauda equina syndrome or Conus medullaris syndrome, patients often face a daunting journey filled with uncertainty and numerous challenges. However, comprehensive patient education and access to support resources can make a significant difference in managing these conditions and improving quality of life. Drawing from the insights provided in Aptly's System of Orthopedics and Fractures, 9th edition, we can outline a robust framework for patient education and support. Firstly, understanding the condition is crucial. Patients should be educated about the anatomy of the spine, the specific areas affected by these syndromes, and the potential symptoms they might experience. Knowledge empowers patients to recognize early warning signs and seek timely medical intervention. Educational materials such as brochures, online resources, and instructional videos can be invaluable tools in this process. Support groups and counseling services play an equally important role. Joining a support group allows patients to connect with others who are experiencing similar challenges, providing a sense of community and shared understanding. Counseling services, including psychological support and pain management therapy, can help address the emotional and mental health aspects of living with these conditions. Physical therapy and rehabilitation are also essential components of patient support. These therapies focus on improving mobility, strength, and overall function, helping patients regain independence and enhance their quality of life. Tailored exercise programs, guided by skilled therapists, can be highly effective in managing symptoms and preventing further complications. Moreover, patients should be informed about their rights and the availability of medico-legal support. Understanding the legal aspects, such as workplace accommodations and disability benefits, can alleviate some of the financial and logistical burdens associated with these conditions. Additionally, advancements in telemedicine have made it easier for patients to access expert medical advice and follow-up care from the comfort of their homes. Virtual consultations and remote monitoring can ensure continuous support and timely adjustments to treatment plans. Incorporating family and caregivers into the educational process is also beneficial. Providing them with the necessary knowledge and resources enables them to offer better support and care to the patient. Finally, staying informed about the latest research and advancements, as discussed in the previous chapter, can offer hope and reassurance. Knowing that ongoing efforts are being made to improve treatment options can be a powerful motivator for patients to stay engaged in their care journey. In conclusion, a holistic approach to patient education and support, as recommended by Aptly's System of Orthopedics and Fractures, can significantly improve the management of Cauda equina syndrome and Conus medullaris syndrome. By empowering patients with knowledge, connecting them with support networks, and providing comprehensive care, we can enhance their overall well-being and quality of life.